performed hand hygiene as I came into the room. Hello, my name is Seth Nolan. I'm a nurse practitioner student.
Hello.
Your name is?
James.
James. James, is it okay if I perform a head-to-toe assessment on you today? That's going to involve me touching you, listening to you, and even tapping on you a little bit. Is that okay?
Yes.
Wonderful. So to start with, I'm going to check your heart rate to start with. Is that okay?
Mm-hmm.
All right. This is going to take about a minute, so just relax, all right? Thank you, James. Your heart rate's 80 beats per minute, and you're breathing at about 20 respirations per minute as well. While I've got you here, James, can I take a look at your arms? James has no obvious skin lesions. He has good cat refill on his upper extremities, less than 2 seconds. No obvious problems. James' general appearance is well kept. He's dressed and appropriately and acting appropriately for the situation. All right, James, what we're going to move on to now is we're going to take a look at your head, your ears, nose, and throat, and your eyes, okay? Is that all right?
Mm-hmm.
Okay. To start with, I'm just going to take a look at you. James's face is very symmetrical. His head is symmetrical. It's normocephalic. I'm going to go ahead and I'm going to feel your head, okay?
Okay.
And while I'm doing this, I want you to tell me if you're having any pain or discomfort anywhere. No abnormalities or lesions noted. I'm going to go ahead and while I've got you here, I'm going to inspect all of the lymph nodes, the major lymph nodes on your head and neck. Okay. We're going to start back here at the occipital. Mandibular. Submandibular. Mental. And then go down. Subclavicular. Okay. James, I want you to move your head for me, side to side. Back, forward. Any discomfort?
No.
Okay. Now I want you to do it against I want you to lift your shoulders against my hands, okay? All right, and I want you to push against my hand with your head. Okay, that on? Very good. That assesses cranial nerve 11, okay? I'm going to take a look at your throat real quick. Looking at the trachea. No tracheal deviation noted. Try and palpate the thyroid. Okay. No abnormalities noted. And you've got full range of motion of the neck. Good job. James, what we're going to do now is take a look at your eyes, okay?
Okay.
Okay. To start with, I'm going to have you look right at the tip of my ear, okay? And I'm going to shine this light in your eye. All right?
Mm-hmm.
So go ahead and look right there. Pupils are equal, round, and reactive and accommodate to light, equal bilaterally. Okay? Good job. I'll take a look at them real fast. So the sclera is white, conjunctiva is nice and pink. Okay. Any pressure here as I push on those?
Doesn't hurt.
Sides? No pain? Okay. Good job. The next thing I'm going to do, James, is I'm going to take a look at you from the side. I'm going to start kind of far away, about right here. I'm going to come in front, and I'm going to get really close to you, okay? All right. We're going to see if we can get a reflex on your eyes, all right? So just look forward. Okay. Reflex noted. Okay, really close, okay? Very good. Can we do the same on the other side? Really close. All right, disc noted, edges are clearly defined. Okay. now, what I want you to do is to follow my finger, okay? Just your eyes, not your head, okay? Good job. Very good. Extraocular movement's intact. I'm going to step behind you, James.
Okay.
I'm going to test your peripheral vision right now. I want you to tell me when you can see my fingers, okay?
I see it.
Okay?
I see it.
Good job. Peripheral vision intact. That assesses cranial nerve number 2. All right. So now we're going to take a look at your ears, okay? To start with, your ears are symmetrical to the head. The pinnacle of the ear is equal to the arc of the eye. Any pain or discomfort as I touch your ears?
No.
Okay, how about here?
No.
All right. So James, one more time, I'm going to turn this light on and take a look inside your ear, okay? Okay. Good job. Now on this side. Thank you, James. So the membranes were gray, just like they should be. So good job. You had a good reflex on them. Now I'm going to look at your mouth, okay? Or your nose first, actually. I'm going to look inside your mouth. So I'm going to look up and I'm going to put this and look in your nose, okay? No deviated septum noted. I want you to plug one nose and blow. All right, the other side. There's your patent. I want you to open your mouth, James, and stick out your tongue and say ah. Say ah. Okay. Move your tongue side to side. Up and down. Okay. James has all his teeth. They appear to be in good dentition. No abnormalities noted in the mouth and throat. Being able to move your tongue side to side and say ah demonstrates your cranial nerves 9, 10, and 12 that they're intact. And everything is as it should be inside your mouth. Thank you, James. One more time, I'm just going to touch the frontal and maxillary sinuses to see if you have any discomfort or pain.
No.
Oh, good job. All right. So now, James, I'm going to take a look at your back. Okay. So just from the front, I'm going to take a look. Back appears to be in line, no abnormalities. Symmetrical, very good. James, I want you to take a big breath in and out, okay? Equal chest expansion, rise and fall. James, I'm going to check for firmitis. So what I'm going to do is I'm going to put my hands on your back, and I want you to say 99, okay?
99.
Again.
99.
Again.
99.
One more time.
99.
Good job. Thank you, James. All findings are normal. And while I'm back here, I'm going to go ahead and take a listen to your lung fields, okay? So when you feel me put the stethoscope on the back, I want you to take a big breath in and out just like this.
Okay.
Okay? Good job, James. Thank you. Lung fields are clear and equal bilaterally. Now I'm just going to run my hands up and down that spine. Would you tell me if you feel any tenderness at all, okay? Any tenderness or discomfort?
No.
Okay, no other abnormalities noted. James, I'm going to come around back to the front, and I'm going to take your gown down just a little bit so I can take a look at your chest and inspect your heart, okay? One more time, take a big breath in and out for me. Okay. Equal rise and fall, equal chest expansion. Okay, I'm going to take a look. Just hold still and relax now, okay? Just breathe normal. Good job. No obvious pulsations noted for the heart. I'm going to go ahead and try and find the apical point, the Point of maximal impact. Just breathe normal. You're doing good. Okay. I'm able to palpate that. Now I'm going to go ahead and take a listen to your heart, okay?
Okay.
So James, I'm going to do this on the front here. In 5 places. First the aorta. Then pulmonic. The second pulmonic. The tricuspid. And the apical or mitral. That's perfect. I'm going to have you lay down and I'm going to listen to those again, okay?
Okay.
Go ahead and lay back this way. Thank you. So one more time, I'm going to listen to all those points in the same order. Thank you, James. Good job. Everything appears to be normal as it should be. While you're laying down, first I'm going to elevate the bed. It's about 45 degrees, okay? You just stay put. We're going to see if we can find any JVD, okay? Jugular venous distension. Go ahead and turn your head this way. Okay, JVD noted right here. And measured approximately 1 centimeter. Alright, so now that I've got you here, James, I'm going to drop the bed, and we're going to keep on going down, and I'm going to take a look at your tummy, okay? So first we're going to take a look. The abdomen appears to be flat, without distension, symmetrical, no any abnormalities noted. Lift your neck just a little bit, lift your head up, okay? Very good, no hernia noted. Okay, I'm going to take a listen first, okay? I'm going to listen to 4 spots on your tummy, and then I'm going to tap a little bit, and then I'm going to feel, okay? All right, James. In all 4 quadrants of your abdomen, you have normal bowel sounds. Okay, and now I'm going to what's called percuss. So I'm going to put my finger on here and I'm going to tap it. What we're doing is listening for any dullness or excessive ringing that might indicate gas or obstruction or anything solid, okay? So that ring looks very good, okay? Now I'm going to push kind of hard, pretty soft on your tummy. I'm going to push in all 4 areas. I want you to tell me if you find any discomfort or pain. Anything?
No.
Okay. All right, good job, James. Why don't you go ahead and sit up. Back to the edge of the bed again. Put that back on. Thank you, James. We're going to move on to your lower extremities, okay? We're going to take a look at your legs. Starting off with your knees. Knees appear to be symmetrical without any swelling or fluid collected. Can you lift your legs up one at a time? Straighten it all the way out. The other one. Can you do it as I put pressure against you? Bring them up. Okay. Pull them down. Good job. Any discomfort or pain? While I'm here, I'm going to check for the popliteal pulse. Equal bilaterally. I'm going to work my way down, squeezing your feet, checking for any fluid collection. And cap refill, which is less than 2 seconds bilaterally. I'm going to check the pulse on top of your feet. Marsalis Peters pulse. And just equal bilaterally. No skin abnormalities noted. Appropriate coloring with appropriate hair growth. And posterior tibialis pulses right here. Okay? And those are equal bilaterally. Now at this point, James, based on our exam so far, you've been able to move your arms and your legs pretty well, so we're going to conclude the motor portion of the exam. That means your arms and legs and how they move, okay?
Okay.
So now what I'm going to do is I'm going to test sensation. So what I want, so upper and lower extremity. So I'm going to do, so I've got two objects. One is dull. Can you feel that? See how it's dull?
Mm-hmm.
And the other one is sharp. Can you tell the difference?
Yes.
Okay. So I'm going to test you on your legs and your arms, okay?
Okay.
So I want you to close your eyes and tell me if this is dull or sharp.
Sharp. Sharp. Sharp. Sharp.
Okay, can you bring your hands to the front? Okay.
Dull. Sharp. Sharp. Sharp.
All right. Everything was fine for normal. And now, go ahead and open your eyes, James. Now what we're going to do is we're going to move on to your reflexes, okay? I'm going to start on your upper extremities. Go ahead and sit on the edge of the bed. Very good. So I'm going to check your biceps reflex first. Go ahead and relax. Noted. Triceps. The brachius radialis. Same thing again. The biceps. Triceps. Brachius radialis. Very good. Go ahead and sit back a little bit on the bed. We're going to check the patellar reflexes. Okay. The Achilles reflex. And the plantar reflex. All reflexes were equal bilaterally and appropriate. Good job. So now, James, what we're going to do is we're going to test some rapid alternating movements, okay? I want you to put your hands like this on your legs. And I want you to like that. And repeat that real fast. Very good. Okay, good job. Now I want you to take both hands and I want you to put each finger to your thumb over and over and over, back and forth. Very good, James. Now what I want you to do, excuse me. Sorry. Is I want you to take your finger, touch my finger, and then touch your nose. Okay, and you're going to keep doing that as I move it. Okay, good job. Okay, and now I want you to take your left leg, bring it up, and run the heel of your left leg down your shin. Down your shin. Good job. Now do the other one. Very good, James. And I want you to with your right foot, I want you to tap the floor. Let's go down, tap, tap. Okay, now do that with your left foot. Good job. So go ahead and stand up. Just walk right over here. Now I want you to walk towards me, putting one foot in front of the other, heel to toes. Okay? Check your balance in the gait. Very good, James. Go ahead and have a seat. You have a normal, usual gait with heel to toe. Okay, that concludes our exam. I'm going to go ahead and wash my hands. Thank you for your participation today.